How many people does APD currently serve?
Well, in the waiver, it's about it's between 30 and 31,000 people. On our wait list, again, there's 19,000 people, brings you up to 49,000, and then we have a couple thousand in institutional type programs, so just a little over 50,000.
Out of those people on the waiver, what percentage of them are actually on Tier 4 right now?
It's about 14,000, so it's close to 50%, not quite.
Okay. Now, it seems that Tier 4 is missing a lot of critical services. One that comes to mind is dental. You spoke in April about perhaps getting this changed. Has anything been done to add dental to Tier 4 yet?
There's two things that are on the table right now. One is we were authorized to provide a flexible benefit where if a person is willing to take an 8% discount off of the aggregate cost of their respite, adult day training, supported employment, in-home support services, then we will allow them to self-direct those funds. What I have asked, and this gets into Medicaid regulation, so the best answer I can give you right now is we have asked that for people on Tier 4 that wanted to use their flexible benefit for adult dental, to allow them to do that, because I believe that good oral health is probably key to good overall health. And if a family wanted to forego, say, 10 hours of respite because getting dental care was a more pressing need, I'm hoping that logic wins the day. But this is, but I don't want to create a misperception that that's a done deal. There is an approval process that we have to go through, but I have asked. Now the other thing is we could just ask to add that particular service to Tier 4. And that would have some budgetary implications, not real significant budgetary implications, but since we are still running we are running right on budget. In fact, we're slightly in a deficit, but it's like 2 or 3 days billing. It's the kind of thing that is not causing us problems right now, but it's just there's a thought process you have to go through if you're going to add a service when you're in a deficit to begin with. So that would be the consideration there, and plus our friends in the legislature would also be very interested in that. So there would have to be a consensus among the various players at the Capitol that was the right thing to do.
Okay. Well, it's definitely being worked on.
Yes, we are definitely working on it.
Now, is a person allowed to move from one tier to another? And if so, how can someone move from one tier to a different tier?
It is allowed, and it has happened some already. It usually accompanies some major change in your life circumstance. If a caregiver were to become incapacitated, or to die, or etc., your living situation were to change, those are the kinds of things that you can go back under our current system, and if the change in circumstance is sufficient, you can change tiers.
The 2007 Florida legislature required that APD to implement cost plan rebasing effective January 1st, 2009, and that also cut many people's services. Now I'm told that APD is just about to do yet another cost plan rebasing around the corner that will make more cuts and be made to individuals. Can you talk about why, how, and when this is going to be done?
Okay. The why is because it is a legislative mandate. The requirement to do this effective January 1, 2010 was passed by the 2009 legislature. There were a couple of modifications, or actually one significant modification, is that if a person has experienced a service disruption for at least 18 days, and 18 days, if you do the math, that's 5% of a year. And if you recall, the rebasing is the prior year expenditures plus 5%. So those people either kick into a different type of methodology where we estimate an annualized expenditure for that person and rebase the cost plan to that level, or they don't do rebasing at all. So there's that one twist, and that actually puts in another round of work for us, where I think we're going to have to be relying primarily on support coordinators to alert us to those people who did have a service interruption and thus should not be subject, at least to the methodology that's prescribed for most of these people. The intent of that legislation, as I understand it, was not so much to cut service as it was to try to limit what in previous years had been anywhere from a 10 to 15% utilization increase. And by utilization increase, I mean just cost increases associated with the current enrollees, which was in a $800 million system, a 15% utilization increase is $120 million. So the legislature would have to fund that $120 million and then come up with money on top of that if they wanted to fund the wait list. I think the rebasing was primarily aimed at that, more than actually taking and reducing service levels, but more to hold things basically in line where they are. We are proceeding with our plans. If it is per law implemented January 1st, it will go much like it did last time. We just have that one extra step now to check and make sure there's not an exemption due to that service interruption.